Hello. Edutainment Studios and Access Healthcare welcomes you to our Patient Education Series. This module is about insulin therapy, the ins and outs of using insulin. Every cell in your body needs sugar as its fuel source or energy. However, sugar cannot get into most of your cells directly. After you eat food and your blood sugar level rises as the food is digested, special cells in your pancreas are signaled to release insulin into your bloodstream. The insulin acts as a key to open cells to allow sugar in as fuel. If you have more sugar in your body than it needs, insulin helps store the sugar in your liver and releases it when your blood sugar level is low or if you need more sugar, such as in between meals or during physical activity. Therefore, insulin helps balance out blood sugar levels and keeps them in a normal range. In this course, the objectives are to help you demonstrate knowledge regarding how to use insulin. Your doctor will help you figure out what is best for you. If you have type 1 diabetes, you will usually inject different types of insulin 2 to 4 times a day. With type 2, the number of times you take insulin depends on if you are taking diabetes oral medicines and how controlled your blood sugar is. You only need 1 injection a day, or you could need 3 to 4 injections of different types each day. Most insulin is injected with a syringe or pen, but there are also pump options. Insulin pens work like syringes. You dial the dose on the pen, and the insulin is injected through a needle. Insulin pens only contain one type of insulin, so you could have more than one pen if you need to take different kinds of insulin. If you are wearing an insulin pump, it works by sending insulin to your blood 24 hours a day through a catheter that is placed under your skin. Where you inject insulin plays a role in how quickly the insulin enters your bloodstream. Insulin shots work the fastest when you inject them into your abdomen. They work more slowly when injected in your upper arm, and they work the slowest when injected in your thigh or butt. Do not inject insulin in the exact same spot every time. The insulin will not work as well, and this could cause you to develop hard lumps under your skin. If you give yourself more than 1 insulin injection a day, rotate sites for different shots, but keep the same site for each type. An example would be to use your leg for breakfast and your abdomen for dinner. Always double-check that you are using the correct type of insulin at the correct time. If you are sick, call your doctor to see if your insulin dose should change. Do not skip your insulin or change your dose without talking to your doctor. Keep the insulin bottle you are using at room temperature. Store extra insulin in your refrigerator. Never store insulin in very hot or very cold places. Always check the expiration date and do not use expired insulin. Before you inject insulin, check it to make sure it looks like it should. Do not use insulin that is cloudy or has clumps or particles in the bottle. If you have been taking insulin for a while, you have probably mastered the basics and are ready to learn more about the ins and outs of blood sugar control. Try these 3 how-tos. How to correct a high. If your blood sugar is too high, you know you need insulin to lower it. But how much insulin you need is different for everyone. You will work with your doctor to figure out your insulin sensitivity factor, ISF. This number tells you how much 1 unit of insulin will lower your blood sugar. The key is to check your blood sugars 2 hours after you inject the insulin and see how close you are to goal. If your level is still too high, this might mean you need to use more insulin the next time you have a high. And if it is too low, you will need to use less next time. How to exercise without getting too low. First, find out about how much exercise causes your blood sugar to drop. Test before, during, and after your workout a few times and keep track of your results. Then you and your doctor can make a plan that works best for you. How to handle too many highs and lows. If you just cannot seem to get control of your numbers, it might not be your fault. It could be that your body is reacting differently to your treatment, or that something else has changed. You could need a different dose or different medicine. Talk to your doctor. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of this 4-part series on insulin therapy, and come back for Part 4.